I find with this schema, when it's really active in patients, it really kind of creates quite a significant amount of frustration in therapists. You know, the patient that doesn't do their homework, the patient that doesn't turn up to therapy on time, the patient that drinks after you've gone through all of this kind of effort of creating these behavior modification plans, if you like, to prevent drinking or overeating or whatever it may be. So of course, I'm talking about the Insufficient Self Control Schema. I'm Rita Younan, clinical psychologist, Advanced Schema Therapist, supervisor trainer. Welcome to 7-Minute Schemas.
And I'm Ruth Holt. Yes, today we are talking about a schema that some therapists can really struggle with because it's not a typical schema that we find in therapists. In fact, probably in order to get the job you've got, you've had to be reasonably self-disciplined and self-controlled. So it can actually be challenging to really understand and work with this schema, which, you know, in essence is about a pervasive difficulty or refusal to exercise self-control or tolerate frustration. It's kind of, basically a tendency to avoid discomfort, avoid pain, avoid exertion, which works short term, but of course doesn't work long term. And, it can present in a few different ways in the room, Rita. I certainly, we see the undisciplined child mode often with this, that kind of little kid mode that's like, I don't want to do that. Or maybe an impulsive child mode who's like, I want what I want when I want it, and I don't want to wait, and it's too hard to wait. How else have you seen this schema present in the room with your clients?
Look, in very similar ways, Ruth, and I think one of the things that's really difficult is trying to change the pattern associated with these schemas. When schema therapy is all about these maladaptive patterns over time, whether it's overeating or drinking or not wanting to do certain homework tasks, there's always some kind of reason as to why they haven't done it. And so we can use different types of techniques, whether it's cognitive techniques, behavioral techniques, experiential techniques, which you're going to go into in a moment. And Jeff kind of talks about this idea that usually with insufficient self-control, you have the impulse and the action and trying to kind of create a little bit of a circuit breaker in between to get patients to start thinking before they act.
And that's where I think it's really important, isn't it, to certainly be aware that there could be some biological issues going on. If you've got a client who perhaps has ADD or ADHD, we want to make sure we're assessing for that and giving them support, medication if needed, and not just trying to, build tools that are very difficult. Or even people who've had trauma-related issues, say fetal alcohol syndrome, can often have issues with limit setting and delayed gratification. So certainly we want to do a good assessment. We want to understand what are the origins of this. Typically you've got people who perhaps have not had a lot of supervision and supportive parental input, so that they've really not learnt any of that self-control, or they may have had too much. It may have been abusive, it may have been highly controlling, and then they have always had external or fearful control rather than a safe internal control.
And that's a really good point, because if you think about it from that perspective, Ruth, then, one of the things you want to think about in your conceptualization is what other schemas is this connected to? Is it connected to maybe subjugation, where there was so much discipline, if you like, that they actually are fearful in terms of developing autonomy and resilience, if you like, and being able to develop that internal locus of control as opposed to an external locus of control.
Yeah, that's right. And one thing I find then, if we're really exploring this with clients, is to be aware that often clients are talking about these issues with a lot of their own critic. They're often saying, look, I know I should, and I'm probably pretty hopeless because I haven't got my act together, or my wife thinks that I should be. And we want to be careful that we're not then becoming another demanding critic and kind of getting them in trouble, but rather than being curious. I think about it a bit like getting to know a little kid and being welcoming and affirming and really understanding initially what that's all about. So one key technique that I use is to really tune in to that moment when it just felt like it's all too hard, or I can't wait. And in imagery, start to really attune, get those feelings, really affirm and encourage it in a playful kind of way, and then do a float back from that moment back to childhood, because then often you see the richness of the origin. So I've had clients who we've floated back and their undisciplined child mode, their schema, really developed because they had dyslexia and couldn't actually do the work they were doing. And so rather than feel shamed, that vulnerable child feeling, they gave up. And so they often in their current life were doing that, but we didn't understand the connection to shame until we did the float back. And then you can do some beautiful imagery rescripting, not just looking after that little vulnerable shamed child, but also coming alongside that undisciplined child and saying, I know it's hard, but I'm going to do it with you, and we're not going to shame you.
So really kind of focusing on the need of worthiness around that. And sometimes the need is really just having someone alongside you with doing a float back and just kind of being with you as you do the work and tolerate the frustration and delay the gratification in order to get to that end result. So imagery, affect bridges can really give us a wealth of information in terms of how that schema was developed. The other thing you can do is walk through the modes. When someone kind of comes to you and says, I really tried hard to change that pattern, but I found myself just kind of, eating those 10 chocolate bars, even though I really didn't want to do that, and actually walking through every specific mode, a bit like a chain analysis in some ways, but using chairs to mode that out and understand what was needed at what point in order to change that for next time and managing that trigger differently.
Yeah, there's lots of ideas that certainly we look at in the advanced techniques workshop that we do, where we're covering more of the child modes and maybe more of the sort of impulsive, narcissistic, grandiose kind of presentations. And that's our 7 minutes, Rita. So for all those working with these little undisciplined and maybe impulsive clients, we want you to give it a go. And also, if you're interested in further training, there'll be a link at the end of this video.